Hey guys, I'm back to talk a little bit more about autoimmune encephalitis, and I'm feeling much better, thankfully, from that horrible cold. And please don't forget to subscribe, like, share. Thank you. So, I'm going to talk about all of the tests that I went through in like a year and a half's time, and everything was coming back negative, negative, negative. It was really horrible and stressful, but finally there was one test that was positive. So I'm going to start with the first one. So the first symptom that was really the worst for me was my memory. So I was already seeing a neurologist for my migraines. So then he started doing memory tests on me. I would go down a point like every time I would go back. And he believed that that wasn't normal, especially for my age. So then he said, okay, let's go ahead and do a brain MRI. But before I could get the MRI, I had to do the brain CT scan because of insurance reasons. Both of those were negative. There was nothing going on in my brain. There was nothing that looked like Alzheimer's or early onset Alzheimer's. It was fine. So then my hearing started to get worse. And so I finally went to a hearing aid place, and they said, yeah, you qualify for hearing aids. So I got these cute little pink ones, and they really do help. And what I also like is that when I feel like it, I can turn them off and the world sounds quieter. So yes, there were hearing issues. Um, went kept on seeing my neurologist, and then he decided to do an EEG and EMG. So check how my nerves react, and kind of like made each of my nerves jump, and that was negative. My nerves were perfect. An EEG, see how my brain waves were working, fine, didn't show anything wrong there. Had lots of blood work done, lots and lots of blood work, but normal, just basic metabolic, regular blood work. And still, my neurologist was very stumped. He kept going, kept doing the memory tests, and then finally, maybe about 4 months ago, he decided to do this special anti NMDA blood work, and that came back positive right away. That was the only thing out of all the blood work that was done that came back positive. But if he didn't know to do that test, I would still be lost. My symptoms would be getting worse. So I'm very thankful that my doctor just kept going, and he believed that all of my symptoms were not normal. It was a very scary time, but then I had answers. So then after that test came back positive, to confirm it, I had to have a spinal tap to see how my spinal fluid looked. And what else? So when that blood work comes back positive, sometimes it's believed that something else is causing your body to attack your brain, like maybe a tumor. And the tumor that's associated with anti-NMDA is located usually in the ovaries. So once that blood work was positive, the doctor needed to have me go to my gynecologist and recommend that I get a transvaginal ultrasound to make sure that I didn't have anything going on there. So I had my appointment, I had my ultrasound, and that was fine. I just had a couple very tiny cysts, no big deal. So that was done. So then I finally made the appointment to go have my spinal tap done in the hospital, and I had that done. And right after, I was so sick. I was curled up in a ball holding my head. My head hurt so bad. I was getting very nauseous, almost vomiting. And so the outpatient department said, okay, we're going to call your doctor. And my doctor said right away, okay, admit her. We already know the test is positive. She has this. She has autoimmune encephalitis. So let's go to the treatment. So that was actually a good thing that happened, because that's when I finally got my IVIG treatment. So now let's talk about possible causes. No one knows exactly why this happens. Autoimmune encephalitis happens. Some cases, like I said, could be associated with cancers, paraneoplastic AE, and some are linked to infections such as herpes virus. But many patients, some like me, similar to me, have absolutely no trigger for it. It makes zero sense whatsoever. It usually occurs in previously healthy people, and especially young people in their 20s. That was before COVID. Suddenly, recently, there have been more cases positive from the anti-NMD blood work that are coming positive post-COVID. So right now, at this point, my doctors do believe that mine was probably caused from a COVID infection I had in June of 22. So I'm now considered a long haul COVID person. Plus, I have the anti-NMDA, autoimmune encephalitis. So I have all of these things going on. Thankfully, I am finally feeling better. I had my second dose, my 6th and 7th dose of the IVIG, and I'm feeling so much better. Check out my previous video I did with an update. And thank you so much. I will keep making these videos, keep trying to spread the word, because that's one test that you should have. You should talk to your doctor about if you're having such similar symptoms to me, because I don't believe that I'm 1 in 100,000. I think that number has really changed. Thanks again.